Frontline doctors fighting the growing measles outbreak say it is much harder when HHS Secretary Robert F. Kennedy Jr. says things like this on Fox News.
There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information and encourage them to vaccinate. The vaccine does stop the spread of the disease.
Well, it's true. The vaccine helped stop the spread of measles. A lot of what RFK Jr. said there was at the very least misleading. The adverse effects of the measles vaccine are extremely small compared to actually contracting the disease. And while the measles can cause encephalitis and blindness, they're incredibly rare from the vaccine itself. Between statements like that and the firings at our nation's health agencies, a lot of medical experts are sounding the alarm. Dr. Craig Spencer has fought infectious disease outbreaks around the world and is himself a survivor of Ebola. He has a piece in this month's Atlantic magazine titled "The Diseases Are Coming. Elon Musk's slash and burn government tear will have lasting effects on global health." He joins me now. Dr. Spencer, I want to ask you about a number of things which you've written, but what do you make, first of all, the message that Secretary Kennedy is now sending?
Well, Anderson, the last time I joined you just over a month ago was the day of his Senate confirmation hearing. And I told you at that time that I came into that meeting as a skeptic and left even more concerned. And what I've heard over the past few days is exactly why. What we've heard is the head of health leadership in this country bungling basic facts at best and sharing outright lies at worst. We heard today how he confused, I think, the mumps vaccine for the measles vaccine when he said that measles vaccine declines the effectiveness over time. That's not true. It's a mumps vaccine, so he got that wrong. He also said that measles infections might not be all that bad. Well, it turns out measles infections are really bad. They can wipe your immune system immediately and for years after. There's a reason that we vaccinate. I've seen measles cases. I've seen what it can do. We need to prevent this, and I'm so concerned that he's speaking out of both sides of his mouth, saying we need vitamin A and we need cod liver oil, but also maybe vaccines, but vaccines might be bad. I would like more health leadership at this time in this country during this outbreak. Again, an outbreak of measles that is already larger, more cases in this year than we had all last year.
Yeah.
Instead, what we're getting leadership that sounds like a 3 a.m. infomercial on the magic of cod liver oil.
Elon Musk, I just want to play what he said at a cabinet meeting last month about cuts to Ebola prevention.
We will make mistakes. We won't be perfect. But when we make a mistake, we'll fix it very quickly. So, for example, with USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
So was everything restored and there's no interruption?
No, what he was saying there is a lie. It's an outright lie. Let me tell you why. With all the chaos in Washington, it's probably not something that people focus on, disease detection abroad. But this is the thing that I focus on all the time. My friends are working for CDC and for USAID and for WHO around the world. Those programs have almost all been cut. Right now, CDC has been muzzled, and we have not sent our experts to outbreaks like the Ebola outbreak in Uganda that is actively happening and normally would have been tackled with the assistance of CDC. USAID experts who do disease surveillance and border screening at airports like they would normally be doing at the airport in Uganda are not doing that. We have the World Health Organization that is trying to step up and do that for us, but we're actively taking away their money, and the Trump administration has moved to withdraw. At this moment, what this means for Americans is that we do not have our normal eyes and ears on what's happening with diseases around the world at a time when the number of outbreaks is increasing. The risk is going to be increasing here, and I've been saying this over and over again. We are going to regret this. I promise we are going to regret this.
Because in this day and age, a zoonotic virus, something like Ebola, is only a plane flight away.
That's absolutely true, but think about what's happening. We have an undermining of our disease detection systems abroad, an undermining of science and well-settled science and vaccines and things here at home. Losing one of those would be bad. Losing them both at the same time means that if there is an outbreak that we don't pick up on overseas that comes here to this country, normally our CDC, our HHS, we would have the people capable of doing it. We don't really have them. anymore. We have, again, an infomercial about cod liver oil. We have undermined our ability to detect threats abroad and our ability to respond to them here in this country. And the result is unfortunately going to be disastrous. I don't know if it's going to be next week, this measles outbreak, next month, next year, but I promise we will regret this.
There's a lot more to talk about. Dr. Craig Spencer, we'll love to have you back. I also encourage people to read your article in The Atlantic that's out now.